Welcome back to the Neurology channel, your go-to source for in-depth information on neurological conditions. Today, we're delving into a rare and mysterious neurological disorder known as Creutzfeldt-Jakob disease, or CJD for short. If you're new here, don't forget to subscribe and hit that notification bell so you never miss an episode. Let's get started. What is Creutzfeldt-Jakob disease, CJD? Creutzfeldt-Jakob disease is a rare and fatal brain disorder that affects about 1 in every 1 million people worldwide. It's part of a group of diseases called prion diseases, which are characterized by the abnormal folding of proteins in the brain. Creutzfeldt-Jakob disease, CJD, is a rare and devastating neurological disorder that falls under a group of conditions known as prion diseases. Prion diseases are characterized by the abnormal accumulation and folding of specific proteins, called prions, in the brain. This abnormal protein folding leads to the progressive degeneration of brain tissue, causing severe neurological symptoms. Here are some key points about Creutzfeldt-Jakob disease, CJD. Rarity. CJD is extremely rare, with an estimated worldwide incidence of about 1 in every 1 million people. While it is uncommon, it is one of the most well-known prion diseases. Types of CJD. There are several different types of CJD, each with distinct characteristics. The most common types include sporadic CJD. This is the most common form, and it occurs spontaneously without any known cause. It typically affects individuals in their 60s. Familial or inherited CJD. This form is caused by genetic mutations and tends to run in families. Variant CJD, VCJD. This type is associated with the consumption of contaminated beef products and gained significant attention during the mad cow disease crisis in the United Kingdom. Iatrogenic CJD. This rare form of the disease can be transmitted through medical procedures involving contaminated instruments or tissue grafts. Sporadic Creutzfeldt-Jakob disease. Sporadic Creutzfeldt-Jakob disease, SCJD, is the most common and classic form of Creutzfeldt-Jakob disease, CJD. It is characterized by the spontaneous onset of neurological symptoms due to the accumulation of abnormal prion proteins in the brain. Here are key points to understand about sporadic CJD. Incidence. Sporadic CJD is the most prevalent form of CJD, accounting for the majority of cases. It occurs spontaneously without any apparent external cause or known genetic mutation. Age of onset. Sporadic CJD typically affects individuals in their 60s, although it can occur at any age. The age of onset may vary among individuals. Clinical symptoms. The clinical symptoms of sporadic CJD are marked by rapid and progressive neurological deterioration. Common symptoms include rapidly progressive dementia. Cognitive decline is a hallmark feature, leading to severe memory problems, confusion, and difficulty with thinking and reasoning. Muscle stiffness and weakness. Patients often experience muscle stiffness and jerky movements. Tremors. Involuntary shaking or tremors may be observed. Loss of coordination. Difficulty with balance and coordination is common. Personality changes. Patients may undergo significant personality changes, becoming withdrawn or apathetic. Diagnosis. Diagnosing sporadic CJD can be challenging because its symptoms overlap with those of other neurological conditions such as Alzheimer's disease. Diagnosis typically involves clinical evaluation by a neurologist, brain imaging, MRI or CT scans, to assess brain abnormalities, and cerebrospinal fluid analysis. Brain biopsy, while rarely performed due to its invasiveness, can provide definitive confirmation. Prognosis. Sporadic CJD follows a rapid and relentlessly progressive course. Unfortunately, there is no cure for the disease, and it is invariably fatal. Most individuals with sporadic CJD survive only a few months to a year from the onset of symptoms. Causes. The exact cause of sporadic CJD is not fully understood. It is believed to arise spontaneously due to the misfolding of normal prion proteins in the brain, leading to the formation of abnormal prions. These abnormal prions then induce a cascade effect, causing damage to brain tissue and the characteristic symptoms of the disease. In summary, sporadic Creutzfeldt-Jakob disease is the most common form of CJD and is characterized by the spontaneous onset of rapidly progressive neurological symptoms. Despite ongoing research, the disease remains fatal, and management primarily involves supportive care to alleviate symptoms and improve the quality of life for affected individuals. Unlike most other diseases, CJD can't be attributed to bacteria, viruses, or any other known microorganisms. Familial or inherited Creutzfeldt-Jakob disease. Familial or inherited Creutzfeldt-Jakob disease, CJD, is a distinct form of CJD that is caused by genetic mutations. Unlike sporadic CJD, which occurs spontaneously without any known cause, familial CJD is inherited through specific genetic alterations. Here are key points to understand about familial CJD. Genetic basis. Familial CJD is associated with mutations in the PRNP gene, which encodes the prion protein, PRP. These mutations cause alterations in the structure of the prion protein, leading to its abnormal folding and accumulation in the brain. These abnormal prions trigger the disease process. Inheritance pattern. Familial CJD follows an autosomal dominant inheritance pattern. This means that an affected individual has a 50% chance of passing the mutated gene to their offspring. As a result, the disease can run in families, and multiple family members may be affected across generations. Age of onset. The age of onset for familial CJD can vary widely depending on the specific genetic mutation involved. Some forms of familial CJD may present symptoms in early adulthood, while others may have a later onset, similar to sporadic CJD. Clinical symptoms. The clinical symptoms of familial CJD are similar to those of sporadic CJD and include rapidly progressive dementia, cognitive decline leading to severe memory problems, confusion, and impaired thinking, muscle stiffness and weakness, motor symptoms such as muscle stiffness, jerky movements, and weakness, tremors, involuntary shaking or tremors, loss of coordination, difficulty with balance and coordination, personality changes, changes in behavior and personality. Diagnosis. Diagnosing familial CJD typically involves a combination of clinical evaluation, brain imaging, MRI or CT scans, and cerebrospinal fluid analysis. Genetic testing for PRNP mutations can confirm the diagnosis and identify the specific genetic mutation responsible. Prognosis. Familial CJD follows a relentlessly progressive course similar to sporadic CJD. Unfortunately, there is no cure for the disease, and it is invariably fatal. The progression rate and severity of symptoms can vary depending on the specific PRNP mutation. Genetic counseling. Individuals with a family history of familial CJD may seek genetic counseling and testing to determine their risk of carrying the mutated gene and potentially transmitting it to their offspring. Genetic counseling can also help individuals make informed decisions about family planning and risk management. In summary, familial or inherited Creutzfeldt-Jakob disease is a rare form of CJD caused by genetic mutations in the PRNP gene. It is characterized by a familial inheritance pattern, early or late onset of symptoms, and a relentlessly progressive course. Genetic counseling and research efforts are important aspects of managing this condition and seeking potential treatments in the future. Variant Creutzfeldt-Jakob disease. Variant Creutzfeldt-Jakob disease, VCJD, is a rare and distinctive form of Creutzfeldt-Jakob disease, CJD, that gained significant attention in the early 2000s due to its association with the consumption of contaminated beef products. VCJD is unique in several ways. Origin and transmission. VCJD is believed to be caused by the consumption of beef products contaminated with the prion responsible for bovine spongiform encephalopathy, BSE, commonly known as mad cow disease. This is in contrast to other forms of CJD, which typically arise spontaneously, sporadic CJD, or are caused by genetic mutations, familial CJD. It is thought that when humans consume contaminated beef, the abnormal prions responsible for BSE can cross the species barrier and lead to the development of VCJD. Age of onset. VCJD primarily affects younger individuals, often in their late teens or early 20s, which is different from the typical age of onset for other forms of CJD. Clinical presentation. The clinical symptoms of VCJD can be distinct from those of other forms of CJD. They often include psychiatric symptoms, such as depression, anxiety, and hallucinations, in addition to neurological symptoms such as muscle stiffness, weakness, and coordination problems. Unlike sporadic or familial CJD, where rapid dementia is a prominent feature, VCJD may initially present with psychiatric symptoms, making diagnosis challenging. Neuropathological features. Neuropathological examination of VCJD-affected brains reveals unique characteristics, including the presence of florid plaques and amyloid plaques. These pathological features distinguish VCJD from other forms of CJD. Diagnostic challenges. Diagnosing VCJD can be challenging due to its unique clinical and neuropathological features. Diagnosis often involves a combination of clinical evaluation, brain imaging, MRI or CT scans, and cerebrospinal fluid analysis. A definitive diagnosis of VCJD can be made through brain biopsy or post-mortem examination of brain tissue. Prevalence. VCJD is extremely rare and has primarily affected individuals in the United Kingdom and a few other countries where BSC outbreaks occurred. Public health measures. In response to the VCJD outbreak, various public health measures were implemented to prevent the further spread of the disease, including changes in beef production practices and the removal of specific cattle tissues from the human food chain. No cure. Similar to other forms of CJD, there is no cure for VCJD, and the disease is invariably fatal. Treatment primarily involves managing symptoms and providing supportive care. It's important to note that the VCJD outbreak in the early 2000s prompted significant changes in food safety regulations, including stricter measures to prevent the transmission of BSC to humans through the food supply. As a result, the number of VCJD cases has declined significantly, but research into the disease continues to shed light on prion diseases and their potential risks. Iatrogenic Creutzfeldt-Jakob disease. Iatrogenic Creutzfeldt-Jakob disease, ICJD, is a rare form of Creutzfeldt-Jakob disease, CJD, that is acquired through medical procedures or treatments involving contaminated instruments, tissues, or materials. Unlike other forms of CJD, which may occur spontaneously, sporadic CJD, are inherited, familial CJD, or result from consumption of contaminated meat, variant CJD, iatrogenic CJD is associated with medical interventions. Here are key points to understand about iatrogenic CJD. Transmission. Iatrogenic CJD is caused by the accidental transmission of abnormal prion proteins, the infectious agents responsible for CJD, from one person to another during medical procedures or treatments. These prion proteins can contaminate surgical instruments, medical devices, or grafts such as corneal or dura mater, a membrane that covers the brain and spinal cord, grafts. Medical procedures associated with ICJD. Various medical procedures have been linked to iatrogenic transmission of CJD. These include neurosurgical procedures, corneal transplants, and the use of contaminated growth hormone derived from human pituitary glands. In some cases, ICJD has also been associated with dura mater grafts, which are used in neurosurgery. Clinical symptoms. The clinical symptoms of iatrogenic CJD are similar to those of other forms of CJD, including rapidly progressive dementia, muscle stiffness, tremors, loss of coordination, and personality changes. The specific symptoms can vary depending on the route of transmission and the individual. Diagnosis. Diagnosing iatrogenic CJD often involves a combination of clinical evaluation, brain imaging, MRI or CT scans, cerebrospinal fluid analysis, and, in some cases, a detailed medical history to identify potential exposure to contaminated materials or procedures. Brain biopsy may be performed to confirm the diagnosis. Rarity. Iatrogenic CJD is extremely rare, and the risk of transmission through medical procedures is considered low. Nevertheless, efforts are made to minimize the risk of iatrogenic transmission through improved sterilization and infection control measures. Prevention. To reduce the risk of iatrogenic transmission, healthcare facilities and regulatory agencies have implemented strict protocols for sterilizing medical instruments and ensuring the safety of biological materials used in medical procedures. No cure. Like other forms of CJD, there is no cure for iatrogenic CJD, and the disease is invariably fatal. Treatment primarily focuses on managing symptoms and providing supportive care. It's important to emphasize that iatrogenic CJD is an exceedingly rare occurrence and should not deter individuals from seeking necessary medical care or procedures. Healthcare facilities follow rigorous infection control and sterilization protocols to minimize the risk of transmission. While iatrogenic CJD is a concern, it represents only a small fraction of all CJD cases, and efforts continue to improve safety measures in healthcare settings. The signs and symptoms of Creutzfeldt-Jakob disease, CJD, can be distressing and challenging to diagnose because they often mimic those of other neurological conditions. Here are the common signs and symptoms associated with CJD. Rapidly progressive dementia. One of the hallmark features of CJD is the rapid onset of dementia. Muscle stiffness and weakness. Many individuals with CJD develop muscle stiffness, which can lead to difficulties in moving and muscle weakness. This may manifest as a sudden and jerky startle response, myoclonus, or muscle twitching. Tremors. Involuntary trembling or shaking tremors is common in CJD. Loss of coordination. Coordination and balance problems are frequently observed in CJD patients. Personality changes. CJD often leads to personality changes, including alterations in behavior and emotional regulation. Speech and swallowing difficulties. As the disease progresses, speech and swallowing problems can occur, making communication and eating increasingly challenging. Sleep disturbances. CJD can disrupt sleep patterns, leading to insomnia and frequent waking during the night. Weight loss. Due to difficulties with eating and swallowing, CJD patients may experience significant weight loss over time. Diagnosis and prognosis in Creutzfeldt-Jakob disease, CJD, can be challenging due to the rarity of the disease and the overlap of symptoms with other neurological conditions. Here's an overview of the diagnostic process and prognosis associated with CJD. Clinical evaluation. The diagnostic process typically begins with a thorough clinical evaluation by a neurologist. The neurologist assesses the patient's medical history, conducts a neurological examination, and discusses the onset and progression of symptoms. Neuroimaging. Brain imaging studies such as magnetic resonance imaging, MRI, or computed tomography, CT scans, are performed to detect characteristic changes in the brain associated with CJD. Cerebrospinal fluid, CSF, analysis. A lumbar puncture spinal tap may be performed to analyze the cerebrospinal fluid for specific biomarkers associated with CJD, such as elevated levels of the 14-3 protein or the presence of abnormal prion proteins if possible. Electroencephalogram, EEG. An EEG may reveal characteristic abnormalities such as periodic sharp wave complexes in the brain's electrical activity, which can support the diagnosis of CJD. Genetic testing. In cases of suspected familial CJD, genetic testing can identify mutations in the PRNP gene that are associated with the disease. Brain biopsy, rarely. In some instances, a brain biopsy may be necessary to definitively confirm the diagnosis of CJD. However, brain biopsy is an invasive procedure and is typically considered a last resort. Prognosis. The prognosis for individuals diagnosed with CJD is generally poor due to the rapid and progressive nature of the disease. Several factors influence the prognosis. Age at onset. The age at which symptoms begin can also affect prognosis. Younger individuals with CJD tend to have a more prolonged course of the disease, while older individuals often experience a more rapid decline. Those with more severe symptoms often have a shorter survival time. Treatment. There is no cure for CJD. Treatment primarily involves managing symptoms, providing supportive care, and addressing complications such as infections or nutrition problems. Supportive care measures, including medications to alleviate symptoms and enhance comfort, are essential in maintaining the quality of life for individuals with CJD. Research and experimental treatments. Research into potential treatments for CJD continues, but no specific disease-modifying therapies are widely available. Survival typically ranges from a few months to a year or slightly longer, depending on various factors. It's crucial for healthcare providers and caregivers to provide the best possible supportive care to enhance the comfort and well-being of patients and their families facing this devastating condition. Creutzfeldt-Jakob disease is a rare and devastating neurological condition that poses many challenges for patients and healthcare professionals alike. If you or a loved one are facing this disease, seek the guidance of a neurologist and consider joining support groups to connect with others who understand your journey. That's it for today's episode on CJD. If you found this video informative, please give it a thumbs up and share it with others who may benefit from this information. Don't forget to subscribe to the Neurology channel for more videos on neurological disorders and advancements in the field. Thanks for watching, and we'll see you in the next episode.